Good morning and assalamu alaikum. Most of the physician and healthcare professionals based in low-income countries like Pakistan, they attend dozens if not hundreds of patients each week in their outpatient departments. And some of these patients, they are really interesting patients in terms that they might be having different presentation, unique side effects from their treatment, or some other aspects of their management that needs to be highlighted. Unfortunately, probably because of lack of training, because of their pressing appointments and lack of time, and probably because of a general lack of realization of publishing a case report in international biomedical journals, many of the physicians and healthcare workers, they do not pursue these patients, and the patient goes back, and these physicians, they lose an important opportunity to publish a case report. If you are such a healthcare professional or a physician, probably you're at the right place, because today I'm going to discuss how to write and publish case report. I'm Dr. Farooq, Rathore, working as a consultant and head of department at the rehabilitation medicine at the Pakistan Naval Hospital, Shifa, Karachi. My background, I graduated in 2001 and I acquired my fellowship in physical medicine and rehabilitation in 2009 from College of Physicians and Surgeons of Pakistan. I like to record and publish whatever I see, and so far I have been able to publish 126 manuscripts in collaboration with my colleagues both from Pakistan and abroad, and around 20 of them are case reports. I have also published around 4 book chapters. In addition, I also like to share whatever knowledge I have gathered over the last 15 years, and I do a lot of workshops. So far I have done around 87 workshops on different aspects of research writing, publication ethics, and presentation skills. So the outline of this today's lecture would be that first of all we are going to start and define what actually is a case report, and then we are going to discuss the value of case report in today's 21st century, where everyone talks of evidence-based medicine, systematic review, and randomized controlled trials. Then we are going to discuss that why there is a need for physician and healthcare professionals to write case reports, and then I'm going to discuss and I'm going to help you identify resources that I'm going to help you write good case reports. Then we are going to discuss where to publish these case reports both nationally and internationally, and then we will end this lecture on summary and take home message. Case report can be defined in many ways, but I found this particular definition very appropriate, and we're going to discuss this one. So case report, whenever you report a single case, it is known as a case report, and if there are 2 or more cases, it is known as a case series, but probably both of them have like equal value. So case report is actually a report of a single case of a disease, usually with an unexpected presentation, what we call like a unique presentation or a presentation that you were not expecting. And in this case report, you have to typically describe in detail the finding of the patient, the clinical course of the disease right from the start to the end, and the treatment given, and also in some cases prognosis of the case and the outcome. This case report is also accompanied by often a review of other cases previously reported in the biomedical literature on the same topic, what we call a literature review. And the aim is to put your reported case in the overall context of that disease or that disorder being reported. So this is what is a case report is. It is very interesting to note that nowadays we talk of randomized controlled trial, clinical trial, systematic reviews, and like everyone in medical sciences is actually going after this medical research and publication and writing, and we have a culture of publish and perish. You might be surprised to note that the first formal attempt at documenting the medical writing was actually in form of a case report, and it was actually probably the first documented case report were found in the famous Edwin Smith Papyrus. It is actually around 3000 years old medical treatise, which was found in Egypt around in 1816 or 17, and this is actually a documentation of 48 different cases having different medical diseases, including a very detailed description of 5 cervical spine injuries. So this is the first attempt at documenting case report, which was done around 3000 years back. Around 200 years back, James Parkinson wrote his famous essay on the shaking palsy, and this actually was the first description of Parkinson's disease. Now most of us are familiar with Parkinson's disease, which is a very important neurological disorder and a movement disorder, and a lot of research is being done on Parkinson's disease. But it all started off with a simple essay on the shaking palsy, It wasn't like a trial, it wasn't a combination of literature review and many cases. It was simple an essay or a simple observation or documentation of the experience of a single physician, James Parkinson, on his disease, which actually shed light on this problem, and ultimately the interest of the medical community grew, and now we have a lot of research going on in Parkinson's disease. So William Osler, the famous physician from Canada, he once said regarding documentation of case reports, always note and record the unusual, publish it, place it on a permanent record as a short, concise note. Such communications are always of value. Now I clearly remember that when I was doing my house job, my senior used to tell me that whenever you see interesting case, a difficult case, a different case, please always make a small summary and write it down in your diary, and then you can refer it back whenever you find a similar case in your clinical practice. If I look back, probably what he was trying to say that you can publish lot many case reports if you start documenting the patient that you see on a daily basis, who are different, who are unique, or who are difficult. So probably this is the same thing that Sir William Osler is saying, and it is actually a lot of food for thought for most of us who simply see patients and then go back home without documenting the patients. Apart from that, whenever you want to write a case report, the first thing you might hear from your colleagues is, what's the use of writing a case report? Pakistan Medical Dental Council will not give you any credit for that. Okay, that's one thing, so writing a case report is not for credit. You need to understand that. It's beyond that, it's more of a learning experience. The other critique that you might find on case report is that it is the lowest form of evidence in the evidence-based medicine paradigm, and I totally agree. If you see, so the highest form of evidence considered today is actually a systematic review or meta-analysis, and a case report or case series are pretty down in this hierarchy. But despite this fact, you need to understand that a case report will provide you evidence for effectiveness in a real-world setting, whereas a clinical trial will provide you evidence for the efficacy of intervention in a controlled setting. Now, whenever you read a case report, you can actually relate that case report to the patient that you saw in your OPD probably a couple of days back or a couple of weeks back. But in contrast, whenever you read a clinical trial, even a large clinical trial or a randomized controlled trial, you actually cannot relate that sometime, not all time, sometime to your own clinical practice, because human beings are not numbers. They are not like 200 patients in arm A versus 200 patients in arm B. So probably reading a case report and then relating that case report to the patients that you see on daily basis is probably a more of a real world setting as compared to a clinical trial. Having said that, I am not diminishing the value of a clinical trial or evidence-based medicine or randomized controlled trial, but what I want to say that you can relate a case report more closely to the patients that you see in your OPD as compared to a clinical trial having many patients. Apart from that, you can also consider writing a case report as a stepping stone in the journey of medical writing. Now we all know that there is a journal trend of publish and perish, in which every healthcare professional and physician has to publish something in order to remain relevant in the academic environment. And the problem with the senior faculty members is, unfortunately, in developing countries, again like Pakistan, that most of them were not formally trained in this art of medical writing. And as the time goes by and they become senior, it becomes more and more difficult to learn this art of medical writing at this stage. And so it becomes difficult. And same goes for youngsters who are actually very much interested in documenting and writing, but they also face challenges while writing articles and manuscript for international biomedical journal. Now you need to understand that case report can be considered as a building block toward your journey of writing a good, maybe randomized controlled trial, a systematic review, or a review article, or something like that. Because the basic format or the basic plan of writing a case report is very similar to writing a systematic review or a clinical trial or a cross-sectional survey. So it can actually act like as a building block. You start writing small case reports, you start publishing them in good international or national biomedical index journals, and ultimately it gives you confidence, and then you can write even better. Apart from that, those of you who have started writing articles, they might have encountered sometime what we call a thought block, that you are unable to write anything more, and okay, it's very frustrating and it wastes a lot of time. So in case of case report, if you're really interested, and I'm going to share with you some tips and tricks, if you're really interested and you have done accurate documentation of the patient's patient's complaint, and all the you have collected all the relevant data and all the investigation, it is actually possible to write a case report in a single setting of 2 to 3 hours. Yes, it is possible. So probably again, it gives you a lot of confidence, and it gives you a lot of food for thought that you can actually write and publish in a small time. Apart from that, whenever you publish, whether it is even small case report in an international biomedical journal or an index national journal, it gives you that sense of achievement. And I have seen people who start writing with small case reports, and then they publish them, and they then see their name in the literature, and it gives them that kind of positive feedback loop, and they are really interested in doing more and more and better and better. And this actually leads to what we call an excellence, and sometimes, rather most of the time, these physicians and these students who start off with writing small case report, they ultimately end up in writing really good articles like randomized controlled trials or cross-sectional surveys or systematic reviews. So case report can help you in your journey of excellence toward medical writing. Okay, continuing again the value of a case report, you need to also understand that many a times these case reports, they actually led to major discoveries, and they highlighted issues which were of importance to the patients. I'll give you some quick examples. So this was an article titled "A Preliminary Communication on Extensively Disseminated Kaposi Sarcoma in a Young Homosexual Man," which was published in American Journal of Dermatopathology in 1981. So what was this all about? This was actually the first description of acquired immunodeficiency syndrome, or what we call AIDS. Now we all know that AIDS is one of the most researched medical topics in the world today. Melinda and Gates Bill Foundation have actually committed more than $1 billion toward the research and management and eradication of AIDS from the world. So it all started from a single case report. So you need to understand the value of a case report, that whatever you see can actually make a big difference in someone's life and can actually change the paradigm of medical science. Apart from that, this picture which shows a child with a small arm, this is the famous thalidomide tragedy. So thalidomide was basically a drug which was used in 1960s as an anti-emetic in order to prevent the hyperemesis gravidarum of the first trimester. And it actually led to amelia, that is congenital absence of limbs or small limbs in children like these. And surprisingly, it was Dr. W.G. McBride who wrote a small letter to editor in Lancet. You can see this letter in front of you on the screen. This letter was published in the December 61 issue, and it simply shows that he shared his observation that congenital abnormalities are present in approximately 1.5% of the babies. It's normal, it's the normal statistics. But he actually noticed and observed that the incidence of multiple severe abnormalities in babies delivered of women who were given the drug thalidomide, which came with the name of Distaval during that time in 1960s, during pregnancy as an antiemetic or a sedative, to be almost 20%. So the normal incidence of congenital anomalies was around 1.5% during that time. But in patients who were being put on thalidomide, the incidence rose up to 20%. And these structural abnormalities, including amelia, were significant. And a simple letter to editor, it led to great many investigations. And ultimately, this thalidomide or Distaval was banned both in the Europe and in the US as a treatment strategy for hyperemesis gravidarum in women. And just imagine, a single letter to editor saved lives of probably thousands of children who might have born without limbs if this letter was not published and this thing was not highlighted. So thalidomide tragedy shows you the value and power of writing a single case report and putting it in the limelight. Again, we all are probably very familiar with multiple myeloma, which is a hematogenous malignancy which affects many systems of the body, including vertebral spine, and can lead to collapse. You might be surprised if you go in the historical background of multiple myeloma, that is actually all started around 200 to 300 years back in form of simple single case reports and case description and observation of individual patients by physician who were willing to share their experience and to teach others about a different kind of disease. So multiple myeloma all started with multiple description and multiple case report, which led the physician to give attention to this disorder, and then research started, and now we are very much clear what multiple myeloma is, what are the diagnostic strategies, and how to manage this problem. It all started with a single case report. Once you have decided that it is important to publish a case report and your unique experiences are also worth sharing, you might want to pause for a moment and ask this question to yourself, that whatever I'm seeing and whatever I'm planning to publish, is it really worth publishing? So I'll give you some quick tips that you can just scan your observation through this checklist, and you can decide whether your case report is worth publishing or not. Number one, if it is a recognition and description of a new disease, I just gave you a couple of examples. Probably it is pretty difficult in 21st century because I mean, like picking up a new disease or coming up with a new disease is pretty difficult. So again, I mean, most of the time it is actually a rare manifestation of a known disease, what we call uncommon manifestation of a known disease. So if in your clinical practice you see that a patient with a known disease has presented with a different presentation, with a unique presentation, with a presentation that has not been commonly described in literature and in textbooks, so probably that is actually worth reporting. Apart from that, if you're working in basic sciences or molecular biology, probably elucidation or clarification of some new mechanism of a disease or the treatment strategy can also be considered worth publishing as a case report. Apart from that, many a time whenever you give patients drugs or treatment, the patient might develop some unknown side effects or some side effects which are not described in the literature, and this has got value specifically for people working in developing countries, because most of the literature in the biomedical literature regarding beneficial or adverse effects of drugs and other treatment that we read commonly is actually based on data from the Caucasian population. So it is mostly based on the patients coming from Europe, Australia, or Northern America. And now because of the advances in medical science, we all know that the pharmacogenetics of people in, for example, in China or Korea or Southeast Asia, India, Pakistan, Bangladesh are totally different from people living in Africa or probably Europe or Russia or other parts of the world. So again, you might encounter a different side effect that has not been reported in the literature before that, and you might want to take a note of that side effect, and you might want to publish it as a case report. Apart from that, many drugs, they show some other beneficial side effects, and that can also be published, and they can also give food for thought to researchers, and then they can start working on that. For example, these anti-epileptic drugs like pregabalin and lacosamide, they are mostly used initially for epilepsy, and now they are commonly used for management of neuropathic pain as well, and there are other examples as well. Apart from that, case reports can also be used for medical education and doing an audit of the practices that you are doing. Coming to how to write, the first thing that you need to understand, and specifically it is specifically for people working in developing countries like Pakistan, where we do not have a really good concept of this informed consent, please obtain written permission from the patient or from their caregivers or from their legal heirs in case of patient is not able to give consent, and you have to get the signed informed consent form. Many organizations and many institutes have their own informed consent forms, but for most of the international biomedical journals, they have their own specific informed consent form which has to be signed by the patient or his or her representative. So please, that should be the first thing, because you cannot publish a case report, at least in an international biomedical literature, without having a signed informed consent form. So small things matter most. Please do not forget this thing. This should be the first thing in your mind. Again, the second thing is always get the contact details of the patient and his or her caregiver at the first contact. Again, this I tell you from my own personal experience, because in developing countries, most of the hospitals, they do not have a healthcare management system. They do not have EMR, electronic medical records, and sometimes it becomes very difficult to trace the patient if you want to know an update, or you want to know the prognosis, or you want to know the outcome of the case. So please get the contact details of the patient and the caregiver on your first contact. It's absolutely important. Apart from that, always obtain a detailed history and collect all necessary investigations which are relevant to the case. And it's important to collect all investigation right at the start and then decide which one of them are relevant to the case or not. It's better to be conscious than to be sorry at the end once you do not have a investigation in your hand. Again, take as many pictures as you can, but please be aware of the resolution. Most of the international biomedical journal, they ask you to upload your images and your case report description online, and if the resolution of the image is low, the software will not allow you to upload the image, and your good case report might not be acceptable in an international biomedical journal just because of the poor resolution. Me and my colleagues have actually suffered that. We documented a couple of really interesting cases which were worthy of an international audience, and the text was really good, and we actually got a letter of acceptance, but it also said that we need to upload a high resolution image, and unfortunately we did not have the contact details of the patient, and we were unable to upload a high resolution image, and because of that we were unable to publish our case report in an international biomedical literature. And since nowadays almost every healthcare professional and physician carries a smartphone, so whenever you want to take a picture, please remember to put your camera settings on the highest resolution, and then you can always crop it down and do whatever you want to do with that. Another important tip that I need to discuss is always choose your target journal and read the instruction to authors before you actually start writing the case report. Now you might be, we might say that what is the need of like choosing your target journal before you start writing? There is a need to choose your target journal before start writing, because you need to understand that every journal have their own specific instruction to author, and you have to follow those specific instruction to author and format your articles as per their instruction to author if you want to publish your manuscript in their journal. And since these instruction to author, they can vary between journals, so it's a good idea to read those instruction to author first and then tailor your article as per their needs, and then start writing, instead of writing the article or case report first and then going to the journal and then changing the whole article as per their instruction to author. You will waste a lot of time and energies. Now again, whenever you talk of case report, you might actually listen that people say that case report are being they are not being published anymore, and no journal publishes case report, they are of no value at all. Please remember, this is a false impression. Case reports are not only being published, they are being published at a higher rate, number one. Number two, there are many journals who have become more formal and they only publish case report, and probably the biggest of them is actually the largest journal in the world on case report is actually BMJ Case Reports. As of today, March 2020, BMJ has more than 15,000 case reports published from all around the globe, including more than 100 case reports from Pakistan. Apart from that, BMJ Case Report is probably the only case report journal which has also got an impact factor. So please go online. I have given you the URL at the top and explore this BMJ Case Report. Apart from that, there are many other good biomedical journals who are only dedicated toward publishing case report. I'll give you a couple of examples. There are more than 100 out there. So for example, this is a journal known as Oxford Medical Case Reports. Then you have Journal of Medical Case Report, which is published by BMC, Biomed Central. Then we have this specific to neurology by Hindwawi, Case Reports in Neurological Medicine. Again, it is indexed in Medline. Then again, Case Report in Neurology by Kargar. And if you are working in cardiology and you see an interesting cardiology case, you might want to publish it in Journal of Cardiology Cases. Again, I've just told you there are more than 100 journals which specifically publish case reports, but these are the journals which are indexed in Medline as well. So if you want to publish your case report in a high ranking journal and you want to publish in a index journal in a Medline, so probably these are some of the options that you have: International Journal, International Medical Case Report Journal, Clinical Case Report, JMCR, Case Reports in Medicine, Retinal Cases and Brief Report, specifically for people working in the field of ophthalmology, and Case Reports and Clinical Practice Review. So please go online and explore all these journals and other journals in order to publish your case report. Some other helpful tips that can help you decide where to publish your case report. Number one is novelty of finding and impact on medical care. So if you think that your case report is a really good one, it's very unique, it's worth reporting to the highest international audience, so probably you might want to publish it in an international biomedical journal instead of a local medical journal. Apart from that, you might want to determine the national versus regional versus international relevance of that case report. So there are certain diseases which are more prevalent in one part of the world, and physician and healthcare professional in that particular country have more interest in that disease as compared to an international audience. But then there are certain diseases which are unique, but they have a common interest to people working in healthcare industry all around the globe. I'll give you one example. So when a couple of years back, when I was working in interior Sindh, so I found that people, many patients were coming to me, and they had this different thing, like what we call, in simple words, they were doing skin tattooing in a particular way on their different joints in order to relieve pain. That was the first thing that I saw. The second thing that I observed was that some of them were going to the local healers and quacks, and they were using specific herbs, and they used to burn their skin in a specific pattern, and this practice was known as dagh. It is also done in some parts of Iran, Balochistan and Sindh. Now this was a pretty strange thing for me, that in 21st century people are using things like skin tattooing and like this dagh and skin burn marks in order to manage pain. When I discussed this thing with my colleagues, most of them, they discouraged me, and they said it's a pretty common practice in this part of the world, so what's so unique about this thing? But me and my colleagues, we documented 12 cases over a period of 2 years, and ultimately we were able to publish those as a case series in an international biomedical journal, because editor and readers in that particular journal were very amazed to see that even in 21st century, such a unique and a different form of pain medicine or pain management techniques are being practiced in a developing country. So you have to determine the national versus regional versus international relevance of your case report. Then I just told you there are normally two types of journals. One are known as general medical journals, and other are known as specialty journals. So the example of a general medical journal could be a British Medical Journal, could be Journal of American Medical Association, Journal of Pakistan Medical Association, or probably this Journal of College of Physicians, Surgeon of Pakistan. Now the specialty journals are one that specifically publish only in a specific or on a specific subject. So you can have specialty journals in orthopedics, in neurology, in pathology, in cardiology, in any subject. So you need to understand that would you like to publish in a general medical journal, or you would like to publish in a specialty journal. Again, if your case report is of general interest, so probably it can be published in a general medical journal. But if your case report is very specific to a specific specialty, for example, you are writing a case report on some disease of retina or cochlea, so probably it might be a good idea to publish that case report in a ophthalmology or eye journal and an ENT journal respectively, because cochlea and retina are very specific things, and probably general public and general physician and healthcare professional might not be having much interest in these things. Apart from that, you have this general medical journal versus case report journals. Again, I just told you that many general medical journals have option of publishing case report, and then there are specific journals that only publish case report. So you can make a choice between the two, and then you can tailor your article as per their instruction to author. Apart from that, a very important thing that most of the people they forget to take into consideration is the issue of open access option. So open access is that whenever you publish, you have to pay a certain publication fee, which may range from $100 to $1,000, and it actually covers the fee of publication and review process, and then your article or case report is freely available for everyone to read and download. At one end, it really looks nice that you can actually publish something that is available to everyone and everyone can download it, but you need to understand it will cost you a lot of money. And again, I just told you it can cost you somewhere between $100 to $1,000, and for that you have to read instruction to author. Many journals, they offer authors and researchers from developing countries like Pakistan waivers, but sometimes the waiver might be only 50%. And again, 50% of 500 US dollar will be again 250 US dollars, which again might be a bit too much for a researcher to pay if he or she wants to publish in an international biomedical journal. So you need to understand and take into consideration the cost factor and the open access option. And last but not least is again the acceptance rate and peer review process. So there are certain journals which might take 4 to 6 weeks in order to reach a decision, and there are certain journals which may take more than 6 months. Most of the time this is clearly mentioned on their websites, or you can read some of the previous articles and you can get an idea that on how when was this article submitted, when was it revised, and when what is published online. So it can give you an idea about the peer review process and the acceptance rate. And if you are in a hurry, so probably you might not want to publish in a journal that takes 6 to 10 months to reach a conclusion. But again, it's important that you understand all these things before you start writing, and it will make your journey of writing pretty easy. Now coming again to how to write, the structure. So this is the structure of the usual structure of a case report. It varies from journal to journal based on the instruction to author, but the journal format for a case report remains the same. First of all is and I'm going to discuss each one of them in detail, but just let's quickly go through them. So first of all is the title, then is the abstract, keywords, introduction, or you might call it background, case description, or a case report, discussion. It is sometimes optional and sometimes it is there, and then conclusion and learning points. So this is the overall structure, and then we are going to discuss in detail each one of them. Starting from the title. So please understand that title is probably the most important part of any manuscript, not only a case report, of any manuscript. And unfortunately, this is the thing that most of the writers, they give the least value, least importance. Title is just like a cover page. I mean, honestly speaking, just pause for a moment and think, whenever you do a literature search, what is the first thing that you read? You don't start with reading like the abstract or the full text. You simply read and scan the articles and make a decision based on the title. If the title is not interesting, if the title is not relevant, you are not going to read that case report or that manuscript at all. So same goes for you as well, that whenever you are writing a manuscript, please pause for a moment and try to create an interesting title. The title should be concise, to the point, but at the same time it should be informative and convey the information that you want to convey, and it should be relevant to the subject. Catchy is actually, some people, they do not recommend it, but again, it's not a hard and fast rule. You might want to write a title in a catchy way, in a questionnaire, in form of a question, or you might want to add a little bit of humor as well. I mean, there are no clear-cut guidelines. If the journal allows that, you might want to experiment with that. So one of the ways that you can actually create a good title is that start writing multiple titles whenever you start writing your manuscript. This holds true both for a case report and for any article as well. And as you go through writing your article or your manuscript or your case report, things will become more clear to you, and you can actually then scan and revise the title as you go about writing. And you should choose the final title at the end. And one of my senior colleagues who guided me used to say that in the end you should actually come up with 3 most relevant titles, and you give those titles to your other colleagues. And if they are unable to understand those titles, it is highly likely that nobody is going to understand those titles. Because please remember, you write for others, you do not write for your own self. So please write titles which are concise, informative, relevant. Write multiple titles. Keep on revising those titles as you go about in writing a case report, and choose your final title at the end after discussing with your colleagues. Again, some people advise that you should avoid the use of words like case report of and literature review in the title in order to keep the number of words within the limit. But again, it all depends on you and the instruction to author. If they allow that, there is actually no harm in using these words, case report of and literature review. I'll give you a couple of examples, and you can see there are diverse case reports from diverse specialties, and they are of different types. For example, an uncommon cause of abdominal pain following blunt abdominal trauma. So please go back to the first slide I just told you, that a case report can be an uncommon presentation of a common thing. So abdominal pain following blunt abdominal trauma is pretty common. But this case report actually describes an uncommon cause of abdominal pain following blunt abdominal trauma. Hemophilia, a rare presentation of intrabiliary hydrated disease. So intrabiliary hydrated disease is probably a common thing, but intrabiliary hydrated disease presenting as hemophilia is probably a rare presentation, so it made a case report. Severe back pain and lower limb extremities weakness in a young male. Now we all know that back pain in young males is pretty common, but back pain with lower extremity weakness in a young male, no, that is something uncommon. So you get an idea, how people make titles and how they make their titles catchy, informative, and these titles intrigue you. You would like to explore more about this severe back pain and lower leg extremity in a young male, because you might have seen a patient with a similar presentation couple of weeks back. So this is how people go about writing titles. Now look at this title. It is a 2-line title. It's a big title. It seems like a small paragraph. A novel anterior revision surgery for the treatment of cervical ossification of posterior longitudinal ligament PLL. Case report and review of literature. Now cervical ossification of PLL is a common thing, and many surgical techniques are advised for the management of cervical ossification of PLL. But here the important point is that the author is going to describe a novel, a new, a unique, a different anterior revision surgery for the treatment of PLL. So many of you who are surgeons and you sometimes experiment with the surgical techniques that you do, and sometimes you get good results. So why don't you publish your good techniques, your different techniques, or the techniques that give you good results in form of a case report, and that can actually change the practice of medicine or the surgery. And again, the last one is presentation of a hemangioblastoma in cavernous sinus, an extremely rare case report. So probably, if you go in the detail of this case report, so they describe that why having a hemangioblastoma in the cavernous sinus is an extremely rare case report and has not been commonly reported in the literature so far. So this gives you an idea of how to write good, catchy and informative titles for your case reports. Now second thing is abstract, and again please give some time in making a good abstract as well. And abstract, as you know, are of two types. It could be structured and unstructured. Unstructured means that it's just like a paragraph. It does not follow a structure. So as you can see, that this case report on a 75-year-old female with hemoptysis and recurrent respiratory infection, this abstract is in the form of a 7 to 8 lines a paragraph. So this is known as what we call an unstructured abstract. Now this case report by my colleagues and myself, again it is also an unstructured abstract. You can see this. There's no structure. There's simply a single paragraph followed by keywords. In contrast, a structured abstract will have a structure. It would have subheadings, and these would depend on the instruction to author of that particular journal. For example, we published this case report in Journal of Spinal Cord Medicine, and you can see that this journal follows this structured abstract approach for the case report. It has got 3 subheadings. One is context, number 2 is finding, and number 3 is conclusion. So if you want to publish a case report for Journal of Spinal Cord Medicine, you might want to follow, you should actually follow this structured way of writing an abstract. Again, another structured abstract for a case series, case report. It has got 3 again subheadings: introduction, case report, and conclusion. So whatever the instruction to author say, please remember you have to follow them. It says structured, you follow the structure. It says unstructured, you go for an unstructured paragraph-like format. Again, another important thing to understand is the word count limit. Again, you need to read the instruction to author, and most of them for case report, they have a limit of 150 to 350 word. It all depends on the journal. So if there are a limit of 150 words for the abstract, you cannot have 151 words, because whenever you are submitting your article online, you need to understand that the computer will not allow you, the online submission system will not allow you to proceed if you have even a single word more than the word count limit, and it sometimes highlights in red and does not go the submission to move forward. So you need to understand, you need to read the instruction to author, you need to understand the word count limit in order to avoid last minute frustrations. Please do not give any reference in the abstract. It is not allowed. And try to minimize or try not to use any abbreviation in the abstract section. And if you have to use abbreviation, please explain the abbreviation at the first use. And again, you also need to understand that abstract is supposed to be a brief summary of the whole. So you cannot like describe each and everything in those 150 to 350 words. You have to include important information only, and only you can decide what is the important information that you might want to give in an abstract for a case report. Keyword, again, depending on the instruction to authors, most of the journal they would allow you to use 3 to 5 keywords, but some journals may allow up to 10 keywords. Again, depends on the instruction to author. This is not my focus of attention for this particular lecture, but those of you who are into medical writing, those of you who are physician or healthcare professionals, please try to understand and learn the use of MESH database. So MESH is Medical Subject Heading Database. This is how it looks like. It is a free online resource, again from Medline or PubMed, and it is actually a scientific tree of around 30,000 scientific keywords. And at least most of the international biomedical journals from Europe and Northern America, they encourage you to use this MESH database keywords, which can then link your article to the scientific literature. So please give it some time. It's a free resource, pretty easy to use. It has got a small learning curve, but you can actually use it. So please try to use and identify your keywords from the MESH. Apart from that, one other recommendation is please do not try to use the word used in the title as your keywords. So if you have used certain words as in your title, please just simply do not take out those words and start putting them as your keywords. Why? Because whatever you use in the title will be considered as keywords by the computer algorithm, the AI. So you have got another chance to increase the impact of your article by using certain different keywords. So please try to use certain other smart keywords from the MESH database and do not use the word used in the title. Coming to the introduction and the background, you have to provide first of all a brief background of the disease or the drug or the device being used. So you might want to probably give some statistics, or you might want to give that how this disease was detected and what was the first case report of this disease. Then you have to mention the problem and mention the significance. Again, let's say if you are doing a case report on a stroke patient, or a patient on cerebral palsy, or on patient on hydrated disease, or on a patient of varicocele, it's a rare presentation or a different side effect. You might want to first of all define that problem. Then you might want to comment on a little bit on the prevalence and the incidence of that disease in your own community, in your country, or probably if you don't have statistics for your own country, probably the global statistics. And if it is a disease that kills, you might want to comment on the morbidity pattern or the mortality pattern. And then obviously if it's a drug or a device, you might want to actually comment on the financial and social cost of that problem and or that disease. That should come in your introduction and your background. And as we say for a research article, that the introduction of a research article should end on the aims and objective of the study. Similarly, the introduction or the background section of the case report should end on and should clearly explain why this particular case report is worth reporting. Is it a rare disease? Is it a unique or a new perspective of a known disease or a known drug, or is it a unique or a different side effect of a device? You need to clearly state this in your introduction. Only then it would make any sense. Then coming to the main gist, that is the case presentation. Obviously, first of all, please maintain the patient confidentiality. You don't need to use any identifiers, and in some cases they don't even allow you to use like a 45-year-old Pakistani male. They might want to say use a middle-aged Asian male. So whatever the journal asks, you have to follow that, and you don't need to mention the patient's background, or the patient where he came from, or from which hospital did he get his treatment and stuff like that. So please maintain patient confidentiality at all cost. And whenever you are trying to describe the problem, please describe it in a chronological order. So always start with a detailed clinical history, starting from how did the problem start? Was it traumatic, non-traumatic? Is it progressive, non-progressive? Is it associated with some other problems or not? Family history and stuff like that. Then you have to describe the relevant clinical examination in detail. Please remember, there is a major difference between the clinical examination that we do for our clinical exams and then we describe in exams, where we have to describe everything in detail. In a case report, you don't have much room to manipulate and much room to write. So you only focus on the pertinent positive and negative findings. which make sense and which are relevant to that particular case report. Then you have to mention the important investigation, and again you do not need to mention or describe in detail the negative investigation or the investigation which are normal. So for example, in a case of some brain lesion in a case of a brain lesion on MRI, you do not need to mention each and every laboratory investigation in detail, and sometimes the journal allows you simply to write that all biochemical parameters were within normal range. But if the journal asks you to write all biochemical parameters in detail, then you have to follow that. And obviously then you have to comment on the outcomes of the disease or outcome of the intervention on the patient, and for example in rehab sciences you have also to comment on the functional outcomes. Then all these case report or these unique patients, they always come with certain relevant positive and negative finding which make you diagnose these cases and which help you learn and teach others. So please highlight these relevant positive and negative findings. And the most important thing is that you do not start judging and you do not start commenting on your case presentation on your case in the case presentation section. You simply describe the case in detail, and whatever comments that you have, whatever discussion you want to generate, you should do in the next section, which is known as the case description or case discussion section. And again you might want to focus on the novelty or the uniqueness of the case report. Again the same thing, that whether this is a truly new disease being reported, or is it a unique side effect or a unique or rare presentation of a commonly known disease. Then you have to relate it to the previously published material. For example, if you are writing a very interesting case report on AIDS, you might want to link it to the first case report on AIDS which was published in 1981 in the American Journal of Dermatopathology. If you are writing a unique case report or an interesting case report on Parkinson's disease, you might want to relate or correlate or connect it with the essay by James Parkinson on an essay on shaking palsy, and it goes on like this. Then it is very important that you provide learning points and lesson for your audience, because I just told you that case reports are actually real world evidence. These are the cases that you can relate to you in your clinical practice. So it's important that you also describe that what have you learned from this case report that other can then integrate in their clinical practice. And please remember, it's a possibility that whatever you do, still the patient was not able to survive and he or she might actually expired. But that can also be a learning point and lesson for many of us, and you might want to share those insights. Then many a times, there are still ambiguities at the end, and you are not very much clear that what happened to the patient. And as a physician, it's pretty okay that you actually declare that you are unable to finally elucidate the mechanism of injury or the mechanism or the problem, and then you can work on that. And if you have some alternative interpretation for that problem, you might want to explain that as well. And I just described that many case reports change the paradigm of medical science. So you also might want to discuss the implication for clinical care and if applicable for further research of these case reports. Case report usually have a lot of figures and tables, so a couple of words on this. Please always follow the instruction to author regarding figures and table. Again, if they allow you only 2 figures, you cannot put in 6 to 7 figures. And if they only allow 1 table, then you have to stick to 1 table. If you do more than that, they are not going to accept your article. Then again, the same thing I'm going to re-emphasize. Please take high resolution images and upload them appropriately after doing whatever editing they ask you to do. Patient confidentiality has to be maintained, and unless there is a really pressing need to identify the patient's face, the patient face should be left out or cropped out, or the eye should be blackened out. And again, appropriate labeling and figure legend is absolutely important and is a requirement for most of the journals, and it is especially important in radiology, in which you have to sometimes describe a lesion or a small finding on a radiograph or on an MRI or a CT scan. So you have to label it appropriately. Apart from a case report, you need to understand there are other formats for publishing case reports, and if you're really short on time and you don't have time even for a case report and you only have like 1 weekend or couple of hours, I'm going to share with you certain other avenues of publishing and writing case report in international biomedical journals. I'll quickly go through them. You can publish them in form of letter to editor, visual vignette, clinical picture, image challenge, and clinical quiz. Now the format might differ in different journals, but the journal idea is the same, that it is actually a small case description, hardly 2 to 300 words, and there are only 1 to 2 figures allowed, and you can actually have a case report worth publishing within a couple of hours. I'll quickly go through them. The most common and the most simple is known as clinical image and visual vignette. What is a clinical image? So it can be an interesting observation. It can be an interesting observation, an image or clinical sign that you see in your practice. It consists of a single image or up to maximum 4 high quality images. Brief description, only 150 to 300 words. Unstructured format, there are no subheadings. No or less than 5 references, so you don't even need to bother about the references. Either there are no references allowed, or you only have to put in only 5 references. But you need to understand the number of author is limited. So you can't have whole of the department coming in as co-authors. So mostly they allow only 2 to 3 authors. And for this, you need to read the instruction to authors. Again, I'll give you a couple of examples. Okay, so this is the New England Journal of Medicine, which has so far published around 2,000, more than 2,000 figures and multimedia in this visual vignettes. I'll give you one example quickly. So this is a squamous cell carcinoma of the lung, and if you can appreciate this, basically, okay, so look at this one, yeah, the right upper corner. So if you can see that this is basically a case report of a squamous cell carcinoma, in which they, when they took the CT scan, so the patient had the cigarettes and the lighter along with the inside his pocket, and this also came up on the CT scan. So again, interesting thing, but it was worth reporting, and it was published in NEJM. Apart from that, this again another image in clinical medicine from the New England Journal of Medicine. It is titled Bilateral Digital Ischemia. I'm not a dermatologist, and once I was presenting this in a lecture, and a dermatologist stood and he said that what's so important and unique about this case report. I said that honestly speaking, I'm not a dermatologist and I'm not clear what's so unique, but there's something so important and unique about this case report of bilateral digital ischemia that NEJM decided to publish it in their journal. So please remember that most of you are actually seeing many good patients, many good radiographs and interesting cases, if not every day, every week. You need to understand that many of these patients are worth reporting. So please gear up yourself and start writing. Now look at this image. Traumatic tension pneumothorax causing heart rotation. Now, since I work in Pakistan and I can verify that our trauma centers and our ER departments in the major hospital, they receive more than 1,000 patients each day, and there's a possibility that such cases of traumatic tension pneumothorax are being diagnosed, are being managed every week in these major ERs. It's so unfortunate, like people see cases, people manage them, and they simply send them back home or to the next department. They don't follow them up and they don't do report. And look at this. Traumatic tension pneumothorax causing heart rotation has been published as a clinical images in clinical medicine in NEJM. This is from Lancet. Cervical osteophytes causing cerebellar infarction. Now, any one of us working in medicine, in surgery, in orthopedic surgery, neurosurgery, neurology, rehabilitation medicine, physical therapy, they commonly see patients with cervical osteophytes, cervical spondylosis. Look at this simple case report of around 100-word description and only 4 images. And it is actually a large cervical osteophyte which caused cerebellar infarction because it impinged upon the basilar circulation system. Again, a simple case report, but again published as a clinical picture in Lancet. For my colleagues working in surgery, sorry. So this is a case of Boswellic hernia. Again, probably it's rare, but again, it has been published in Lancet. So the point is, many of you are seeing such cases in your clinical practice, but you don't formally document them. and you lose an opportunity to publish these unique and interesting case reports and cases in international biomedical literature. So this presentation should give you some food for thought, that next time you see a patient, you not only manage him or her, you also try to document and publish it. Again, schistosomiasis detected during appendectomy. Again, food for thought for my colleagues working in surgery. Apart from that, there's another category which is published in Lancet, is known as clinical quiz or image challenge, and as you can see, so far they have published around 95, and this is important. You know, whenever you publish your small manuscript or your picture in form of picture quiz gallery, it will be submitted to NLM, that is Medline, as for indexation, and your picture quiz gallery manuscript will be indexed in Medline. Again, coming back to the image challenge of the New England Journal of Medicine, if you can see, it's pretty simple, and this is how actually patients present to us in our OPDs as well. Honestly speaking, patients do not come to us in form of patient XYZ or 50 patient in group A versus 50 patient in group B. They present to us with description like these. For example, look at this. A 29 years old man with a history of aplastic anemia, blah, blah, blah. What is the diagnosis? So they give you these 5 differential diagnoses and you have to describe that which one of them is more appropriate. You click and they tell you which is the most correct diagnosis. Now the most important thing that I want to tell you is, look at this. 43,000 responses on this single clinical image, and there are clinical images who have more than 100,000 responses. Now these things and these tools of the 21st century allow you to share your unique experience with thousands of people all around the globe on a single click. It was not possible before the internet era. Now it's possible to reach out thousands of people and to teach them and to train them and to give them food for thought in form of these small clinical images, visual vignettes. So please try to understand that life is not about doing the work all yourself. Life is all about learning and then teaching. So each one of you comes with a unique experience subset. It's time that you start documenting it in form of clinical images, visual vignettes, and these questions. And it's not going to give you a self of satisfaction, increase your publication count. It's also going to train and teach your colleagues all around the globe, just like this small clinical case. Apart from that, many of you who do this procedure, you also might be interested in this thing, what we call figure and multimedia. Again, it is from the New England Journal of Medicine. And again, sorry, I'll go back. Yeah. So again, in this, people, they upload small videos of 8 to 10 minute duration on different important topics, like for example, tracheostomy or decannulation of tracheostomy, how to reduce a fractured elbow, a dislocated elbow or a dislocated shoulder, how to do catheterization, the simple clinical skills that most of us do in our daily life. So you can actually document and make a high quality video on that, make a small 5 to 6 pages page write-up, and that can be published in any GM as figure and multimedia. Apart from that, it's a very important and a very interesting thing that I like probably the most is JAMA clinical image, JAMA clinical challenge. JAMA is Journal of American Medical Association, and this is how the patient would present to you in your OPD as well. So for example, look at this JAMA clinical challenge. The title is an adolescent with right shin pain, and the description is a 15 years old obese girl presented to clinic with increasing right shin pain, blah blah blah. Again, the pain begins after the patient began to play competitive basketball, was localized to her mid shin. What would you do next? There are 4 options, and if you go back, this is how we practice medicine actually in our OPDs. I mean, the patient comes to us with a presentation or problem, and we start thinking that what could be the differential diagnosis? What should I do next? Should I do some laboratory test? Should I refer immediately to the orthopedic surgeon? Should I order the immediate immobilization? Or should I only order a watchful observation and give her some painkillers? This is how real life practice is done in everyday life. So they tell you that, you know, the best option is, the most likely diagnosis is actually a stress fracture of the anterior tibia, and you need to do all those things, and then, you know, it is described in detail. Now this is what I was telling you in the beginning. This is what we call a real world evidence. because you can relate to this case much more easily than any other clinical trial. Another example of JAMA clinical challenge, a chronic nail pigmentation in a 50 years old woman. Again, small description, the way they would present to you in your clinic, and then you have to like have 4 options. What would you do next? There are 4 options, and probably since the diagnosis is nail matrix melanoma presenting as longitudinal metanonychia and distal pigmentation, so it is recommended that removal of the entire nail plate with representative biopsy of all area of pigment. It's a practical problem with a practical solution which has been published as a JAMA clinical image challenge. Pretty simple, because each one of you sees such challenging cases in their own clinical practice, and probably it's time that you start documenting them. Last thing is that whenever you are about to write a case report, please follow the CARE case report guidelines which are available from this website. CARE guidelines are actually developed in year 2013. They were developed like 8 years back, and they were published twice in 2013 and in 2017 in Journal of Epidemiology, and they were developed by an international group of experts, and the aim was to increase the accuracy, the transparency and usefulness of case report. And these guidelines have been endorsed by multiple medical journal publishers and translated into multiple languages. For those of you who are planning to write for International Biomedical Journal, they must actually download these CARE guidelines. 2 advantages. Number 1, it will give you a template on how to write a good case report, number 1. And number 2, many of the International Biomedical Journal, they actually ask you to upload a scanned copy of these CARE guidelines, and they ask you to write your case report as per the instruction given in the CARE guidelines. So it's absolutely important that if you want to write a case report, please follow the CARE guidelines. The last piece of advice would be, please avoid predatory journals at all cost. Again, this is not the main focus of my presentation today, but to give you an overview, predatory journals are one of the most important academic scam of 21st century. And in short, predatory journals, as the word indicates, predatory, they are like predators. They are fraud journals, they are scam journals. They claim to be authentic journals, but they do not have a peer review process. They have fake metrics, they have fake IDs, they have fake impact factor, and they actually dupe patient researchers and physicians in publishing in them, and they do not carry any value at all. So please avoid predatory journals at all cost. And for that, the most important resource that is available out there is actually this website, which is known as thinkchecksummit.org. Please go and explore this website, and it will give you a lot for food for thought on how to avoid predatory journals. So the summary and take home message is that case reports are easy to write, they boost confidence and improve writing skills. The case report which you plan to write should either be unique, or that is new, novel, or should be a rare or a unusual presentation of a common problem or a disease or an unusual side effect of a drug or a device. Please follow the instruction to author and write in clear, concise way and to the point. Do not go beyond the word count limit, because the online submission system will not allow you to proceed any further. And while you are writing a case report, always highlight the learning points. What have you learned, and what would you like other people to learn from this particular case? In the end, it's not what you look at that matter, it's what you see. You see hundreds of patients each month, each week, but unfortunately, you miss out on many interesting case reports. I hope this lecture stimulates you to document your next important and interesting and unique patient as a case report, and then publish it in an international biomedical journal. If you're interested in getting a copy of the presentation, please feel free to email me. If you have any comments, you can actually write them down or email them to me. If you have any question, any additions or any other resources, I would be glad to get more feedback from you. Thank you very much and take care.